Services Committee meeting to order. It is November 19th, 2024 at 3:45 p.m. We're going to start business with Department of Health. Director?
Sure. So are we going to go through my stuff first, or we want to start with them?
Let's start with them.
Yeah. Okay. So we're here today with one of our fellows. Our health department is participating with the New York State Public Health Fellowship Corps. So we're fortunate enough to recruit Dr. Demba Keita to work with us on creating a Columbia County sanitary code. So I will hand it off for Dr. Keita.
Yeah. That's the right one?
Yeah, that's it.
Okay.
Yeah. I wanted to sit over there.
Yeah, okay, sure.
Yes.
No. Thank you.
Yeah.
Don't take a rest.
Hello, good evening, everyone. My name is Demba Keita, as the director has said. We made this presentation 2-3 weeks ago at the Columbia Green Community College with some community members. It wasn't highly attended, but at least we had some attendance. Just to go through briefly what a sanitary code is, and also to look into some history of how New York State came to have its own sanitary code. And we as a county, we are in the same stage. Just the difference is that in those days, there was no sanitary code to look up to. While we here in the county, we have a New York State sanitary code that we are using at the moment. So as you see on the slides, we will look into a brief history of what has happened in the past. The origins and early adoption of the sanitary code. Now, the New York State began a formal public health efforts during the 1850s to combat disease outbreaks like cholera, typhoid, and smallpox. Now, in 1866, the New York City Metropolitan Board of Health was formed to address on sanitary open conditions, setting a precedence for health regulation. Now, early municipal and state efforts focus on water supply, sewage disposal, housing conditions, and food safety. Now, the formal creation of the sanitary code, which in the end results to the public health law in the 1990s, the New York State legislature consolidated various health laws, giving birth to the public health law, which authorized the development of a statewide sanitary code. Now, the New York State Department of Health was tasked with drafting and enforcing these regulations to standardize health practices across the state. Now, the first comprehensive sanitary code was funded in 1914. This was adopted by the State Board of Health, which tasked the New York State Department of Health to come up with the first known sanitary code for the state. Now, in the 20th century, in the 1990s, due to urbanization and industrialization within the state, the rates of disease increased with poor housing, unsafe foods, and inadequate waste disposal. Now, the new regulations address restaurants, inspections, milk factories, drinking water, and communicable disease control. So it doesn't just go into to contain every health problem that the state has. Instead, it looks into some things that are urgent at the time. And they started with restaurants and milk, and as we all know, just with the nature of dairy products, they attract disease and infections. Now, codification and regular updates happen as time goes on. After World War I, World War II, the sanitary codes went to expand and modernize. The code was modernized, and in 1946, the sanitary code was revised and incorporated into the New York State Public Health Law, making its provisions enforceable statewide. Now, as time goes on, within the 1960s and 1980s, concerns about environmental hazards such as air pollution and hazardous waste led to further amendments. So the code kept evolving, and later communicable disease outbreaks, for example, polio, also prompted stronger measures in immunization, water sanitation, and sewage treatment. Now, in the 1990s to present, the New York State Sanitary Code continues to evolve. Some counties will choose and pick, will emphasize on certain parts of the sanitary code. And why I'm saying that, you will see in the next slides as we go on, that each county, some counties look at their challenges. They look at what areas do they have more challenges, and then they will focus on those areas. So this is why we want to come up with our own sanitary code and look at the areas that we have most challenges with, and then we'll make emphasis on those areas rather than just trying to look at the whole sanitary code, which we might not have resources to address. Now, the current framework and infrastructure, the sanitary code is divided into 10 parts. That means the New York State Sanitary Code we are talking about. And each county health department is authorized to enforce the code locally and required a state public health law to have its own sanitary code. Now, what is sanitary code? A sanitary code, maybe we would have started with this, is a set of regulations that governs public health, sanitation, and environmental safety. It also ensures compliance with state and federal health guidelines. Now, why are we getting our sanitary code? Again, to reflect new public health challenges in our county and environmental priorities for county, and to address community needs for modernized health and safety practices. Now, key objectives of the new sanitary code will be public health protection, environmental sustainability, and community well-being. Now, what are some of the main public health and environmental challenges in our county? We have water quality and well contamination. Many residents rely on private wells, which may be prone to contamination from agricultural runoffs, septic system failures, or natural contaminants like arsenic, sewage waste management, and aging septic system. In the rural areas, there can be leaks, portion leaks to groundwater, limited access to public sewer systems in some areas. Now, tick-borne diseases, air quality issues, access to healthcare services, food security and nutrition. Now, other challenges that we might have, which might not be very important at this point, but it's important to mention: substance use and mental health, environmental hazards and climate change, aging population, and chronic diseases. Now, major components of the sanitary code, some areas that we'll be looking at. Our focus will be on these areas: wastewater management, housing standards, public health nuisance, water quality and public water systems, water well construction, food safety and protection, agricultural practices. Now, how will this affect you? How does it affect us as residents of Columbia County? For homeowners, it will ensure compliance with new wastewater and housing regulations. And for renters, it will improve living conditions with better enforcement of housing standards. And for businesses, it will enhance stricter requirements for waste management and sanitary operations. Now, importance of Columbia County having its own sanitary code, it will help staff to have a more tailored, specific focus on, instead of just looking at the New York State Sanitary Code, which is huge. And so it will allow them to have a focus on their day-to-day activities. Now, also, it will give them clear guidelines, as we say, for staff and enforcement, and it will also support for local businesses. When we are doing this, we don't just want to, we don't want to chase our businesses away, but we want to encourage them to continue to invest in the state, in the county. And so we are hoping that it will help businesses by setting clear expectations for food safety, waste disposal, and public health compliance, fostering trust with consumers. Again, improve public health outcomes, emergency preparedness and crisis management, community confidence and engagement, because we want our residents to have confidence in our department, that knowing that we have our own sanitary code and we are monitoring our restaurants, our water system. So in that case, it helps us to improve confidence and engagement with them. Now, implementation timeline, we are hoping that if the Board of Supervisors approve it, then we will have it implemented. Now, next slide. Just want us to look at the next
Oh,
the next
presentation.
presentation, yeah, before we go into question and answers. Now, in drafting the Columbia County Sanitary Code, we make comparison with other counties. From our research, next slide, please. We have approximately 15 counties that have their own sanitary codes, even though it appears to be more than that. Other counties have just what we call an extension of the New York State Sanitary Code, but they don't necessarily have their own sanitary codes, but they have an extension of the New York State Sanitary Code. But these counties have specifically their own sanitary codes, as you can see on the slide.
So most of our neighbors.
Yes, most of our neighbors, Ulster County, Dutchess County, Westchester, Putnam, they all have their own sanitary codes. Greene County, not yet, because they follow Columbia County. Yeah. Now, as we said, the sanitary code, we've already defined what the sanitary code is. Key aspects that we will be looking at specifically with the sanitary code is public health and safety, adaptation to local needs, environment and compliance. Now, typical areas covered by the county sanitary code will include as water supply, wastewater management, food safety, housing and sanitation, public health, nuisance, environmental health, emergency preparedness, and ATUPA. And ATUPA is adolescent tobacco. Yeah. Yeah. All right. Examples of county-specific focus. For example, rural counties might emphasize private well testing, septic system maintenance, and agricultural nuisance. Urban counties may focus on housing quality, food safety in densely populated areas, and industrial pollution control. Now, coastal counties often include regulations to protect coastal waters from pollution and manage stormwater. Now, for drinking water qualities, we made some comparison, and the counties with enhanced private well regulations, where, for example, Dutchess County and Ulster County, they have more emphasis on drinking water qualities. Their regulations, they have stricter regulations compared to the state sanitary code. Now, counties with
I'm sorry.
yeah.
The next one.
Now, counties with coastal water quality protections, those include Nassau and Suffolk County, and counties with focus on industrial pollutants is Erie County, and that's because they have industrial activity. Next slide. Now, counties with stricter septic system regulations, Putnam and Orange County. Counties with combined sewer system focus, Monroe County, and coastal area wastewater protection, Suffolk County have stricter regulations when it comes to that. Now, food safety regulations. You will see that Albany County and Westchester, and that's because of the the urban nature of those counties. They are more strict when it comes to food safety and also regulations for mobile food vendors, Monroe and Onondaga, and seasonal and temporary food establishments, Saratoga. And housing and sanitation, you could see that Albany again and Westchester, strict regulations when it comes to housing standards. For seasonal housing, Ulster County and Saratoga. We have, looking at the county as an agricultural county, we have seasonal housing too. We can also look into that and then enhance our seasonal housing. Enhance public housing oversight every county. Now, focus on agricultural nuisance, Dutchess and Ulster County. They have strict regulations to look into that. And urban nuisance control, Albany and Westchester, coastal pollution, focus, Suffolk and Nassau County. Now, environmental health regulations, air quality regulations. With some of these areas, we can just have it in our sanitary codes without having emphasis. So from what you have seen, this comparison is just to allow us also to look into areas that are more important for us, looking at the characteristics of our county, and then we can tailor our sanitary code, making emphasis on those areas, rather than just going in for all those areas. Now, for emergency preparedness, counties that have comprehensive plans, for example, Dutchess and Putnam County, Suffolk and Nassau counties look at natural disaster preparedness. For disease outbreaks, you have Onondaga and Monroe County. Now, a Columbia County sanitary code, when developing a sanitary code for Columbia County, it is essential to focus on the unique characteristics, as I said, environmental concerns, public health needs, and community priorities specific to our county. And this is a table of content of the areas we want to include in our sanitary code, as you can see. So, yeah, that's it. And if you have any questions or recommendations, and
So is this a roadmap?
yes, kind of.
Okay,
Yeah.
this is a frame to
This is-
start the process.
Yes, this is a frame, this is a guide to guide us as to what direction are we going. Yeah, and some of the what strategies we are taking to create a sanitary code. And that is by making that comparative analysis, what else counties are doing. Yeah. Last week we had a meeting with our public health engineers. Yeah, and then just to get their input, and then that's all part of the process. We met, as I said, on the October 19th, we had a meeting with our with community partners, and we are hoping to meet our mobile home park managers, and also to meet town code enforcement officers, right?
Very targeted meetings.
Yeah.
Don't get as much
Exactly, just to get their input.
by people who will be working with us in
We don't.
these.
Exactly. We don't want to take them by surprise that you guys don't tell us anything, you just bring us the code. So to have their input on that. Yeah. Yes, sir. Go ahead.
If we bolster this expectation in the way that it's being suggested, can we have adequate staffing to enforce it? Even if we partner with building departments and things like that, code enforcement, we're good?
So our intention with creating a targeted code towards our characteristics is to alleviate some of our staffing issues, to really prioritize, not leave anything by the wayside really, but to prioritize the things that are most important to our county and to the health and well-being of it.
But to answer that question a different way, our code officers don't do any of this. This is all referred to the county.
Yes.
We have no engagement at the local level. These are all county referrals. at the moment. I don't know how that it'll evolve over time.
What's the intent with, talking about water well testing on private homes, existing homes? What's the intent of that? I mean, I know businesses test water, but what is, I mean, obviously, this is great as a roadmap, but we don't want to become too onerous to residents of Columbia County that are,
Right, and there are many things up here that
you may
we
not
won't
even.
necessarily
Exactly.
dedicate a lot of our focus to, but there are certainly options if they suit us. I really like the part of Demba's presentation where he goes through all the different focus areas of each county, because you can identify those counties and be like, yeah, Erie is worried about air quality because they have Buffalo and all that industry. And so we want to draw similar comparisons and find those things for our county, or identify those things for our county to focus on.
So I think it's also more proactive because at the moment you have a well problem when somebody gets sick. But if you had a program that encouraged people to test their wells occasionally
And provide education as to how to do so and when to do so, yes,
Is
absolutely.
there any money to help the homeowner remediate their well? With the
Yes,
system, there's just funds available to people?
yes.
So
Not from us, but there are, yes, we can assist them in finding that.
Actually, we were talking about a program this morning at the Housing Task Force redevelopment meeting. There is a program now available for homeowners and businesses to upgrade, improve, or expand their well and septic systems.
The governor just passed a
Right.
grant or just gave money to a grant for all of
Yes.
that. For 200 million.
I will say that
Timing's good.
this process started with Ron Knott, myself, and Ray Drakowski meeting with Victoria about septic systems, because we have a concern about the engineer who's working with the health department retiring soon, and how are we going to handle this moving forward? So that turned into a bigger conversation, but I mean, that's where I think, and we had met about this, the first focus being the septic system issue.
And that's a great example of certain areas being of absolute necessity. And certain areas really, hoping to alleviate some of the burden on some of our other staff so that they can focus on what's most important in our county.
And the cost to put this all together is coming from where?
So Demba is with us through the Public Health Fellowship Corps, which is a free program to us. He's with us for 2 years to be doing this work.
Yeah, and just answering your question about what's the objective of why are we testing? I think it's even beneficial to the residents themselves if they can test their water at least once a year or at least twice a year, just to know the quality of the water that they're drinking without the health department. If we had the human resources, we would have just done it, at least just to help for public health, rather than enforcing it. But from our meeting with our public health engineers yesterday, they had very fruitful recommendations as to what our focus should be. Yeah. And again, the objective of the sanitary code is just to protect the public health, the health of our public, of our residents, and also to make life easy for everybody, so that all partners know what is required. Because sometimes we receive calls in the department and they said, hey, we need to do this, what do we do? You said, well, we don't have a code for it. Call the state. So, and some residents get bored up with that.
Well, the time the state is not all that easy to get hold of.
Exactly.
For many of us.
Yeah.
I think it's a great idea and I'm glad we're looking at this proactively rather than reactively. Thanks for a good start. Can you share the slide deck?
Yeah, sure.
Supervisor Alvarez, did you?
Yeah, I do. I was just kind of thinking, it's probably way ahead of it, but is like the well testing, is that going to be an added cost to the homeowners? And is like the testing free, or is it going to be like if somebody builds a house and they have a brand new well, are they going to be required to test it every couple of years, or is it going to be how old your well is and what's around it, those kind of things? Or is it just going to be, you got to test your well? you know?
Well, we haven't made those kinds of decisions yet. I can say that it's probably not going to be our priority.
Yeah.
To be putting that kind of, regulation,
Okay.
onto the individual homeowners with
Yeah.
private wells. We've got a lot of other things we want to address.
Just things, you know,
Right now, to test your well costs money. If you send it
Yes.
to like
Yeah,
Rensselaer,
Yeah,
whether
The
the county's gonna be providing water bottles and there's somewhere to do that, I don't know, but I don't know about that.
but is it, do you test your well on a recommendation or is it a man?
So if you sell your home, you have to
Yes,
test
that-
your well. And then there's, like I said, Brian Collins and Rensselaer, you gotta figure out a way to get the bottle, and then you gotta get the bottle to him. And then.
we
you
have
know,
the bottles, but we don't pay for them.
Right. So there's,
Okay.
I'm sure if they're
I
gonna
don't
do
have
that,
a
there'll
well,
be
so
a
that's why.
roadmap to make that easier, because someone that's, it's not that simple.
Yeah,
But making the public aware that you might
Sure.
want to test the water is not a bad thing.
Yes, right.
Some people
Which
are
we-
used to municipal water where it's always tested, it's always regulated, they
Correct.
know that.
yeah.
Then you buy a home in the country and you've got a well and they never think about it.
Right.
You know, until they sell their home or something.
That's
So
Correct.
educating them is not a bad thing. I don't want to mandate it, but you
And
know,
you start with elective testing. People
Right.
can test if they choose to.
I would be supportive of that. Yeah.
Right.
So your plan is to maybe visit us every so often in this committee and keep us updated?
Absolutely. If you'd like us to do that, we can
Yep.
certainly do that.
Yes, absolutely. All right, any further questions for the doctor or the director? Thank you both so much.
Yep.
Thank
And we'll
you.
get into some regular business, huh?
Thank you so much. Thank you.
Thank you,
Doctor.
doctor. Thank you.
Thank you for the treat.
Oh, yeah. No?
All right, I just got 3 resolutions for you all today.
Yes, I know.
First is request for permission to authorize to appoint Letha Piero to our Board of Health for a 6-year term.
I'll move it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Very good. Request to authorize the health department to contract with an agency to provide evaluations and services for preschoolers. This is the Taconic Hill School District who are performing this for us.
Move it. Second.
You can figure that one out.
Exactly.
Further discussion? All in favor? Aye. Opposed? Carried.
And then my final resolution is permission, request for permission to enter into
Move
an
it.
affiliation agreement with SUNY Alton. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you so much. And then I have my director's report to present. If you have any questions, please let me know.
Did this committee see the article that was forwarded about the EI Hub rollout? I
They
think it would
didn't, but I'd
benefit
be
them if
happy
we
to
could send
share
it.
that.
Yeah.
Yes, I will make note to share that with you, Kelly, if you wouldn't mind sending that out.
You warned us.
You know, we had low expectations, but somehow they still, no,
No,
this is
the other
actually,
one, sorry.
we'll send it on.
Okay.
They
I saw it
somehow
somewhere.
even- surprised us with how poorly this could have gone, unfortunately. Yeah, the system itself is slow and burdensome, and it's causing a lot of headaches and chaos on the side of the providers, on the side of the county. And unfortunately, it's the most vulnerable children who are going to, suffer from this.
Because we do have several on each waiting list.
Yes,
well.
absolutely, absolutely, yes. Any other questions about anything in my report? Yeah, I held this, the only thing I wanted to highlight, our immunization clinic was, booming in October. We had all our respiratory, clinics, so those were extremely successful.
And the new recommendations on the COVID vaccine are get one 6 months after your first one.
Yeah. For certain populations, yes.
I know they were full because I tried to get into 2 of them and couldn't, so that was good.
Yeah, that's a good thing, a good problem to have, but I hope you did get in eventually.
All right, any questions for the director?
I will just mention one more thing if I can. In 2025, we are working on the community health needs assessment. And part of that is a community survey with several actually quite generous prizes. If you all would take one and share, the QR code brings you to the link, and then I can send that digitally to you too.
It actually came out. I
It did, it
posted
went
to the
all-
website.
Oh,
Yeah.
perfect. Okay, so I'll just link these here.
If you do send you the link, I'll put the link in my newsletter.
Perfect, thank you so much.
Not everybody in my town uses Peter.
Yeah, I know. It's been,
Mhm.
about 7 minutes. Not too long at all.
Thanks.
All right.
Thank you.
Thank
Thank
you so
you.
much.
Happy Thanksgiving.
Thank you, you too.
All right, social services, Commissioner Gibson.
The physicians, I all went through the point one, before coming here. First request is to fill one case with the position.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. The second request is a full-time transportation aide.
Move it. Second.
Further discussion? All in favor? Opposed? Carried.
Thank you. The third request, one full-time social welfare examiner.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then, a request to, finalize our agreement with the Mental Health Association, for, overseeing the operations at the, Ranch Hotel and Memorial Mission.
Move it.
Second.
Further discussion? All in favor? Opposed? Carried.
And then this is sort of housekeeping, but I've got to ask, I've got a request from this board that the chairman accept the child care block grant, on behalf of the child care.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Just direct you to the, stats and, housing is continuing to be the issue and,
What's that number? I'm sorry, I can't read.
165 is the second.
23 or 31?
we're,
23
The last
families.
column,
Under homeless.
individuals, families.
105.
yeah.
Rooms, yeah.
Yeah, so what you're seeing, if you go over, it is in fact 163.
And then it's 23?
Yeah, so then you break it down.
And
Like
families
if you have
and
adults,
Yeah, no, I know, I just couldn't see the numbers.
yeah,
30, is the 33 adults and 49 children? Is that what that is?
So foster care also looked at,
yeah.
what
So
happened?
what happened there was a large family. Our number around there is about 40, and that's where, my director thinks our sweet spot is, but I don't know where these numbers are gonna go. Over the weekend, Mission was up to 15. Remember, I've got cots if I go over, but we're getting close and our rooms are pretty much filled, so it's a day-to-day operation.
What is the allowable child to caseworker ratio?
So that's a good question. It's usually more based on cases, but, and we try to keep those at around 5 to 7, something like that. And if there are a remarkable amount of children in a certain case, that's going to inform whether or not that particular caseworker is going to get something.
Am I reading this correctly? Are we at 17 for this month
Mhm.
as opposed to 5 to 7? Yeah.
Yeah, that's partly sad.
Okay. Just wanted to
Yeah.
be sure. Okay.
Yeah, that's partly staffing and partly that's probably one of the workers that got the big live.
Well, the cases were up too. You got 20 cases in 1 month. That's a lot. Yeah. Okay. Thank you.
Thanks, everyone.
Thank you, sir. Henry, youth development.
Have a couple resolutions.
The first one is to authorize the existing contracts, for 2024-25. Do I have a motion?
Here.
Second? Further discussion? All in favor?
Aye.
Opposed? Carried. And we added 2 new programs to this year's funding. One was from the youth team sports, which is the Columbia Clippers. It's a baseball program that takes kids from all over the county, and they're different age groups. And the other one was the Twin County Recovery Services. That was a youth summit that they had with kids in October, addressing alcohol abuse needs.
Well attended.
Yes.
And
And it's all underneath the OCFS funding.
these are marketed through the schools? How is this marketed?
This is marketed through our website. And I think I do send it out to towns.
I don't
Yes.
remember seeing it. That's why I was asking.
So you need a motion on this.
Yeah.
I'll motion, I'll
I'll
motion. I'll motion it, baby.
Motion second, all in favor?
Aye.
Opposed? Carried. And the only other thing is we paid out all the money and the county's been reimbursed from the state.
And swims grant?
They're actually doing an article on it. Jesse DeGraw. It's coming along. That's all I know.
Okay.
And it's
In my
good
budget for next
right.
year, so
And it's
I'm
good for funding all the way up to September 30th, 2025.
good. Thank you. Happy Thanksgiving.
Thank you.
Very organized with this. Yeah. That's for her benefit, because she says that she's very efficient and recycles them.
Yes, I do. And it's saving money. I think we were missing a resolution.
Yeah, I was just looking here.
I've got page 2, but I don't have page 1.
The
Yeah.
County
Could've
Youth
been the
Forum,
cover
Columbia
page.
Clippers, we kind of mashed them into one. didn't we?
Oh, yeah. Yes, we did that. That's you. That's done. But now I'm on to
Oh, I'm
Dan.
sorry.
No.
Right, were you speaking to this Dan or
Yeah,
that Dan?
you're Dan.
Okay, this Dan.
I'm
Maybe the
missing-
cover page, the agenda page is.
Well,
it's
no,
the
I'm
first
missing
page
the
to
first
this
page.
resolution. Yeah.
Authorization to modify the 2024 budget to account for additional state aid.
Okay, right, so that's the first financial resolution that I have. So,
So basically, you're just look.
yes, I'm
You can
requesting,
explain it.
I'm requesting for approval to adjust the 2024 budget.
Yeah, I can see.
There were some, funds that we needed to move for certain line items. We worked with, Jim Breed's office on that, and I just request your support to ratify that. Thank you.
Second?
Further discussion? All in favor?
Aye.
Opposed? Carried.
Sorry about that, Dan, not to get you all messed up.
Oh, it's okay. Hopefully we sent it.
No, you did, and he had, the chairman has it, but it just didn't get scanned.
And this second financial resolution is requesting your support to contract with all the various vendors throughout 2025. Move it. Are listed there.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
Third financial resolution is requesting your support to use federal salary share dollars to assist the sheriff's department in purchasing the requested X-ray device to eliminate the occurrences of contraband coming into the facility. The sheriff and undersheriff had reached out to me. I've spoken with several supervisors to just suss out the discussions that had been had previously without me being present and, receive their support. So I ask for your support to assist the sheriff's department in purchasing this device.
I'll move it.
Thank you.
Second. Further discussion?
Does this increase staffing at the sheriff's office as well too? I thought that was originally one of the concerns.
It's my understanding, again, I wasn't present for the initial conversations, but the way I understand it is, no, an officer would operate this machine. It's one officer to operate it. They're really looking to reduce the instances of contraband coming in, potentially saving the life of an inmate or an officer if a weapon was smuggled in or contraband in the form of drugs, which could be fatal.
So we're just gonna have a federal salary sharing offset for an existing employee?
No, that's what purchase this. There's a grant.
Purchase of equipment. So
There's a
how-
grant that covers the majority of it. I don't know what the total is.
You got a legislative grant. I'm not sure if you read them.
No,
Assemblywoman Barrett for $125,000.
I saw that.
The machine was 100, so we needed
This is the
25.
difference.
And I'm sorry if I'm a step behind everybody, but I didn't understand why we would be using federal salary sharing funds for an equipment purchase if it didn't involve additional employees.
The federal salary share funds are funds that are available to support, various behavioral health initiatives.
Not just be, not.
No,
just-
no,
That's
not
what-
salary.
That's what I'm-
It's a-
Sorry.
It's in the name,
It's
yeah.
such, it's
He
such a,
purchased cars with that.
yeah,
Okay, okay, thank you.
yes, it's such a deceptive title.
It
took
is.
me a while
It sounds
for me to get my
restrictive.
head around it,
Okay,
but
okay,
it's the dollars.
Steady
that
stream
we-
of fund, grant fund.
okay,
You know,
okay, I'm with you.
Yes,
And I will say that for the sheriff, for a few of the projects, we had asked them to try to find grant money to be able to fund it. And they
And
did.
that's the big chunk of it.
And they did.
Yeah,
they found the grant money and we're just helping close the gap in a way that doesn't, impact the county directly. So, and it does fall within the parameters around, what allows me to use the federal salary share dollars for the courts. I just want to reassure. you
that's
of
my
that.
question. Okay,
Yeah.
thank you.
Okay, so.
All
where
in
we are
favor?
with that.
I,
Opposed? You opposed? No.
Claire? Sorry, I missed it.
Okay, and moving on to the fourth and final financial resolution, this is just to modify the 2025 budget that we submitted, so slight modifications here as well.
Have a motion. Have you talked to Jim about this?
Yes.
Jim signed off on him. Well, he didn't sign off on that one, but he was good with all of Dan's resolutions.
Yes.
We have a motion or a second?
We haven't got anything.
I'll make the motion.
second,
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, on to the general resolutions. There's quite a few of them, I believe 13. So first,
Thanks, Dan.
it's just how it happens with my department. and-
trying to make up for December.
You know,
We'll go quickly, hopefully. First general resolution is to contract with Dr. Jeremy Vos. Dr. Vos assists us with performing the 7:30 competency examinations.
I'll move it.
Thank you.
further discussion? All in favor?
I,
Dan, how often do you get those now? I mean, there's not as many
Uh,
cases.
no, actually, Supervisor Livonia, the number is tending to increase.
Really?
Yes, and that's, we're doing a lot of advocacy and education to, the courts, to the district attorney and the public defender's office in terms of the appropriate use of that. There's a misconception that, 7:30, a restoration order is treatment. It is not treatment. It is simply, helping that person get to a point where they are well enough to participate in their defense. A lot of people don't know that. Some attorneys use this as a tactic as part of their defense. The unfortunate part, as maybe all of us or many of us know, we're on the hook for this.
Yeah.
We pay for this as the county, and that meter can run fast and furious. So the fact that there's an increase of these 7:30s being requested throughout the entire state is concerning. The conference that I belong to as the Director of Community Services is doing a massive amount of advocacy on the state level to somehow correct that so that the counties aren't on the hook for the entire amount.
So are the majority of them coming from county court or from local courts or both? All, yeah.
It's a mixed bag.
No, I know it comes from all. I'm just
I've
curious.
ordered 2 in the past year, which I
Really?
haven't done in the
Where
past
would we
20.
order? Yeah.
20
So is that
years.
coming from the DA's office?
It can come from the DA, it can come from the public defender, it can come from a private attorney, it can come from a judge. And it's all of those.
No, I know they all know. I'm just curious why, who's ordering them, that's all. But, okay.
And then, is that why we're approving 2 vendors tonight? We're also approving CNH for this, right?
Right. What's necessary in the 7:30 examination is there has to be 2 independent evaluators.
Okay.
So we don't have 2 staff people that can do it. We have Dr. Carlos Valle, who's on our staff, and he does participate. Dr. Jeremy Vos used to be with us, but since left, but has agreed to stay on as a contracted
Consultant.
entity consultant. And sometimes there's a tie, so that the tie has to be broken. So we need a third entity, which is where Columbia Memorial Health comes in.
Okay.
Were there any opposed to that resolution?
No.
All right, carried.
Okay, resolutions 2, 3, and 4 have to do with, recruiters. So resolution 2 is requesting your support to continue to contract with Corzen, which is a recruiter for, prescribers mostly, as is resolution 3, which is Jackson Coker, very similar. And then lastly, First Choice, same thing. That's a recruiter.
I'll move all three.
Thank you.
Question, Dan, how often are we actually using them and paying them a fee?
It all depends Supervisor Agonia in terms of how often I have the need. Right now, things are, knock on wood, very steady, very stable with my full
Last year.
prescribers.
In the last year, I mean.
I haven't had to go to them at all.
Okay.
And then there's also variation in terms of how they construct their fees.
Yeah.
Sometimes they want a finder's fee, sometimes it's set up differently. It's maddening actually, because they're all different. There's no continuity amongst any of them.
So,
But it all seems like handsome compensation.
Oh, very much so. Yes.
so they're the court of last resort, but do you go to all three at the same time if you're trying to fill a position, or do you choose one or the other? You go to,
No,
They're all
if I
three.
have a need, I'll spread as wide of a net as possible.
okay,
They're constantly blowing up my inbox with potential candidates, but if I don't have a need, I just ignore them.
okay.
It's when I have a need that we talk.
All right, I had a motion and a second. Any further discussion on the three resolutions? There being none, all in favor?
Aye.
Opposed? Carried.
Fifth resolution is to renew the contract with Dr. Carlos Valle. I'm happy to report that he's not asking for an increase this year. Historically, he's asked for a going rate. Not the case this year, so I definitely appreciate that. I appreciate his work. So I ask for your support in that contract.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
General resolution number 6 is for Bonadio, which provides us consulting in terms of our CFRs and things like that. So I ask for your support on
Move
that.
it. Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
Similarly to CCSI, which is a consultant organization that we rely upon. So I ask for your support in continuing that contract.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
We touched on general resolution number 8, which was for Columbia Memorial Health, contracting with them for assistance on the 7:30 competency examinations.
Second,
Further discussion? All in favor?
Aye.
Opposed? Carried.
General resolution number 9 has to do with Columbia Green Community College. We already have a resolution and a contract with them to provide them a clinician, a care coordinator to meet the needs of the student body. The college has received a grant and they're able to increase the amount of time they're able to pay for. So we're going to up that to 35 hours or as close to it as possible.
Ma'am, are you okay? Dan, there's a great line in this resolution that says how you're uniquely suited to perform these abilities due to the high level of professional competence, and I'm gonna use that.
Wow, you can steal that line. Absolutely. Thank you.
and I'll move.
I am gonna rob that monthly. All right, I had a motion. Do I have a second?
Second.
Further discussion? All in favor? Aye.
Just to let you know a word about the college, I'm particularly grateful for what President Drummer has done as well as her staff at the college in terms of creating this, I don't know what to call it, a new department or faction of the college that is behavioral health-esque. They've invited us in, of course, and now with increased hours, they have Twin Counties there as well. And they have a worker from, I believe it's the Reach Center as well. So that they're giving such attention to their student body in this way is very impressive, and I'm grateful for that.
All right, were there any opposed to this resolution? There being none, resolution carried.
General resolution number 10 is to continue the contract with Jacqueline Christie, who's a nurse practitioner.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then number 11, we also have a contract that I'd like to continue with Upper Hudson Planned Parenthood, which nurse practitioner Jacqueline Christie carries out on our behalf. 2.5 hours a week of service where she reviews their charts to make sure they're in compliance under an OMH program, Office of Mental Health program that they participate in.
Move it.
Do I have a second? Further discussion? All in favor?
Aye.
Opposed? Carried.
Me.
Unopposed. Carried.
And we're getting to the home stretch. So general resolution number 12 is, I believe it's Southern New Hampshire University, contract with them because we have a student coming in that is through Southern New Hampshire University. So we would like to, be able to pursue that learning agreement, have that student with us. And who knows if we have availability and opportunity to retain them. But that's getting ahead of ourselves.
Is this a paid internship?
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And lastly, I ask for your support to welcome some new members to the Community Services Board and subcommittees. They're listed out there. We're getting good interest in the CSB and the subcommittees, so that's very, very exciting. You may have read in my director's report, though, that our chairperson, the president, Beth Schuster, has opted to resign. So we are in need of a new chairperson for the CSB. We have chairpersons for the subcommittees, but for the CSB, we're on the hunt for a new chairperson. No leads yet, but I'm confident we'll find somebody. But these folks will just be general members.
I'll move it.
Second. Further discussion?
Does the new chairperson come from the existing membership or is she recruited for that purpose?
Ideally, yes. However, none of the existing membership has
Stepped up?
volunteered or stepped up. We've asked, we've inquired, I've cajoled.
But typically, ideally, you prefer it come from.
Yes.
Okay.
Someone who understands the lay of the land and who's been with us and quicker learning curve for that. Yes,
Thank
But
you.
our thanks to the outgoing director.
Yeah.
absolutely. Yes.
All right, all in favor?
Aye.
Opposed? Carried.
I know we may be on a bit of a time crunch. We still have one department to go, so I'm happy to discuss my report. Or if you have questions, you're welcome to call me, reach out to me, email me, and I'll happily discuss anything that I've included in the report. What would you prefer?
We have a few minutes. Would you like to give a brief synopsis?
Sure. Tell me when you want me to stop. Something that I'd like to bring your attention to is the first item I included on the director's report, which was Gateway Industries responding to an RFP for the short-term transitional residents. That's going to be round out the wellness hub as the third leg of the wellness hub. We're proposing 12 units of step-down housing that the state will fund in terms of capital funding as well as operational funding. The sticky wicket there is the staffing composition is incredibly heavy. They require a nurse practitioner, licensed clinical social worker, peer specialists, the direct care staff to be on site at all hours. I think a vocational specialist. It's robust. So there will be a challenge for Gateway, presuming they are successful in getting the RFP from the state, which I have confidence that they will. But then to staff it will be a heavy lift. However, the executive director, Stephanie Turco from Gateway Industries, which is based in Ulster County, they're doing this in Ulster County, and she has assured me that they're going to do everything they can to bring it to Columbia County and staff it. So I'm very grateful for that and very optimistic with the talent and expertise that Gateway will bring to Columbia County. So that's exciting for sure. Oxford House. I don't think I need to reiterate what Oxford House is and what they do, but they are here. They have found a home, an actual building to rent. It's actually a two-family house, which has been modified back to a single-family house. So we are filling it with individuals that are living there. I believe the coordinator plus 5 people have moved in. I think we have room for 3 more.
What is it?
Hmm?
What is that?
Where is it? Thank you. Supervisor Cousin.
Parkwood?
Yes, Parkwood Boulevard. Yeah. Right off of Fairview. Very nice home. It's coming along nicely. So I'm very excited about that. And it's being filled with Columbia County residents. So that's good. Let's see, what else? Project Cope, I mentioned this initiative through the New York State Office of Alcoholism and Substance Use Services. My dual recovery coordinator, JP Cahill, organized training, which Jessica Sorabello from Oasis came down and offered. It was about harm reduction and helping people better understand harm reduction and what that means. It was also about medication assisted treatment, which is medications like Vivitrol, Suboxone, and Methadone. It was very well attended by members of my department as well as other providers. And then what came along with that were several harm reduction products, such as the medication disposal bags with the chemical that will help people safely dispose of medicine, not just controlled substances, but any medicine. Also Narcan kits. And it goes way beyond that in terms of reproductive health products, such as condoms for women, feminine hygiene products, also products like soap, shampoo, socks. The list goes on and on. It was amazing as to what they're providing. And what JP did is he created a kiosk, a shelf right off of our waiting area that our clients can access privately and discreetly with bags so they can put the things in there that they choose. And he's offered that to the other tenants of the building. All of the tenants of the building actually offered it to them, and we met with several of them. I know Claire Pardee from the Healthcare Consortium has put out a display of items. Nina is working on getting with JP as well. And Victoria, I believe, has gotten with JP and is offering those items to their clients as well. So that's exciting. What else can I tell you about? Home-based crisis intervention. This is being offered in Columbia County by Astor Services of Dutchess County. I felt it important to offer space to them on the 3rd floor. So we're sharing an office. Many of our staff work an abbreviated work week. So when they're not there, the Astor home-based crisis intervention worker will occupy that office, and they'll be proximal to the children and family team that operates out of our office, as well as the children's care coordination. If you remember, this program is geared towards diverting children away from the emergency department and away from an inpatient psychiatric hospitalization. So they get in there very quickly and they work very succinctly with that child and that family to hopefully keep them away from out of the emergency department and out of an inpatient psychiatric unit. So we're really pleased and excited to be working with them. They're already working with families. We're going to go
contact with them.
I can give you their contact information as to who the workers are. But if you contact Natasha from my department, she can put you in touch with them.
And is it like crisis hours or just regular business hours? Like we would reach out to them in a crisis room, or you would?
Regular business hours is what they have. A referral comes, but I'm not sure of the hours that they keep. Like if they'll visit with a family, say at 7 p.m., because that's what's to the family. I believe they have that flexibility. What else can I tell you about?
Did you send that under separate cover or did it?
It did go out to all of you.
I just
Email.
missed it. I'm sorry. Thanks.
The DEA, I've learned, has extended the current waiver or exemption for folks who are being prescribed controlled substances to not have to have a face-to-face visit. Historically, if a prescriber, in our case, psychiatrists and psychiatric nurse practitioners, if they were going to offer a controlled substance such as Xanax, Klonopin, Adderall, Ritalin, those types of medicines, which we do offer judiciously to certain clients under certain circumstances, there would have to be a face-to-face visit. COVID threw a monkey wrench into that. And there are many providers out there who do not have on-site psychiatrists, psychiatric nurse practitioners yet. So the DEA finds themselves in a bit of a predicament. They've extended the allowance for they're not needing to be a face-to-face visit. You don't have to have a face-to-face visit to prescribe the controlled substance. So we're grateful for that extension. Good things in terms of the wellness hub. I mentioned the step-down housing that Gateway is pursuing that RFP, but I couldn't be more pleased with the county's support in terms of the nearly $1.5 million going towards RUPCO and the pre-development funds. Repco had a luncheon where they recognized, Columbia County as well as Greenberger, and, just a really nice show of recognition. They have their work cut out for them now in terms of securing the capital funds. I'm very confident that they will be able to do that. In talking to Kevin, their director, and knowing their track record as far as the funds that they've been able to secure for other projects in other counties. One of the things Kevin shared with me is they currently have well over $100 million projects going on at the moment. So the wellness hub coming in at between 30 and 40 million is big, but it's something well within their wheelhouse.
Dan, I think we're getting into it, so,
Okay.
we'll make sure that your report is recirculated, make sure everyone on the committee has it. Thank you for that report.
Thank you.
Um,
Happy to answer any questions you may have, but a lot of good things happening. Thank you.
Thank you, sir. Okay, next up, Office of the Agent.
Hello, I'm Dina. Just to make sure that I'm not wrong, we do not meet next month, correct?
Correct.
Okay, thank you. All right, we'll try to talk fast. So first resolution for you tonight is just to renew contracts with various providers. All are, we've already worked with. The only difference would be Michelle Cram is shifting her role a little bit. Right now, she is kind of our go-to person for the respite program. That the state has changed, the reporting equipment, the online website that we use. So that is actually going to shift back to our case managers, and Michelle's going to come back with a caregiver-focused community engagement role. There's an opportunity actually out in Canaan. I forget the name of the church. Jay Aronson reached out to us about a potential respite drop-in center in the future. So that's going to kind of be the focus for her. So we'll cross our fingers there. But everything else is just kind of as it has been.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Next one is super exciting. A new lease for 2 copy machines in the Philmont kitchen. Woo!
Further discussion? Can we buy those these days? All in favor? Aye. Opposed? Carried. We can, but they just cost me like
Yeah.
$500.
All right, thank you. The next one is, I think I brought this up at the last meeting. Request for approval to return our congregate meal site to the previous location within the Village of Valatia Senior Center.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Last resolution is same idea, the approval to return the congregate meal site to the previous location within the City of Hudson Senior Center. That's the Hudson Public Library.
I'll move that.
I have a question about that.
Yes.
Is that the one that's moving to the library?
Yes, so right now we are,
There's been some issues about people not being able to access it.
access it how?
There's very little parking.
So the only negative, so I went around to our current location, which is in the Hudson Firehouse, and I talked to everybody there, and the only thing I heard was about parking. Right, so there's an idea, I don't know if I'm allowed to talk.
Go
about it.
ahead.
Okay. So there's an idea that I had that was something I was already thinking about, long-term goal is to get the Greenport location reopened, because we had it's across from Town Hall, I don't know what that building's called.
Community center.
That makes sense. So the Greenport Community Center, which is off of Healy Boulevard, used to be a congregate meal site for us and closed during COVID. To my knowledge, it only closed for that reason. So now that COVID is, mostly behind us, for the most part, I would
You're
love
looking at her like she's gonna ward it off. Hopefully, yeah, hopefully you have that power.
control on that?
I don't know if I should have that. But now that, the opportunity to reopen that site is a possibility. Our site manager, who's at the Hudson site, had mentioned, what if we went there instead of to the library, because there is parking there. The state, for, you know, nice SOFA, New York State Office for the Aging would not go for that. They want us within the city of Hudson, and I don't want us to leave the city of Hudson, you know, I'm sorry, I went back to you. So I'm thinking, if we move to the library and open the Greenport site, it may resolve the parking issue, because the 3 people that spoke to me about parking issues were individuals that previously attended the Greenport site and now go to the Hudson site.
So what happened, what happened with the firehouse?
So right now, we pay $400 a month for the firehouse. If we were to go back to the library, we would pay $0 a month, which
So
means
it's about money.
that's one, you know, one factor. You're right. It's a top factor on my list personally, because I'd like to put that $400 a month back into the program to provide better, you know, opportunities to the people that are there. Our site managers frequently will buy things of their own money and donate it to the program, which I appreciate, but they shouldn't have to do that. So there's that. Then there's where we are right now in the firehouse. I don't know how to describe the location, because there's a couple different entrances into the building. Our parking where we are right now is across the street in that gravel area, which is not ideal for people with mobility issues. They have to cross the street, they have to step up onto the curb, because the curb cut is down at the other end. The bus is not allowed, our transportation, which is, you know, an 8 or 10 seater bus, is not allowed to drop our participants off in the entrance of the parking lot at the firehouse, because they claim that it blocks access to firemen in the event of a potential call. So our buses are not allowed to drop people off at the curb cut. They have to drop them off down the road, you know, a little ways. But now that individual needs to walk on the road back to the curb cut or just get back up onto the street. So it's not ideal from someone that, you know, I've worked in the disability field. I try to like point out ADA accessible issues. I don't love it where we are. The other side of it is that the library programming would integrate with what we are currently doing. We would be able to bring meals back to the people that are currently doing senior programming at the library. We'd be able to kind of marry the two and just mutually beneficial for both programs. So I see a lot of positives to it. I see one negative to it right now. And I'm hoping that we could find, I don't know if I'm naively optimistic, which is probably, yeah, I think that's how people would describe it from time to time, but I'm hoping that we could find an alternative to the parking situation. The mayor is actually going to visit the Hudson site tomorrow and have lunch there. So hopefully it's one of our new meal options. We can get his feedback. So he's going to go talk to the participants there. Like I said, I've talked to them.
Well, in the past, that's been the reason it ended up at the firehouse, because people weren't able to park.
Parking
There
and-
was an onerous, difficult space for seniors to navigate, because parking in Hudson
is an issue right across the board.
But didn't we understand in the last meeting that the library had assigned additional spaces or reserved additional spaces?
There's parking on all 4 sections around the library.
Right.
There's 4 or 5 handicap accessible parking
Right.
spots,
That's
which
what I
is what I
remember.
was looking for.
Right.
And then, is that Fifth Street, kind of the front end of the library, that wire street? At the time the program begins, which is 9:30 in the morning, when you drive by, it's not as packed as it is later in the afternoon, when, you know, the school kids are coming in. The program ends at 1:30. So we also have the option, which I offered to the few people that brought it up, is our transportation already goes to the Hudson site and brings people to and from the congregate meal site. So if someone has the ability to drive but struggles with the parking there is an option for them to use our transportation services. So I am hopeful that, you know, we're able to find a way around it, but I definitely hear that it is an issue. The other issue that was brought up prior was the elevators. It has been brought to my attention that the elevators have gone through refurbishment in the time that, you know, the couple of years that we haven't been there. So the only setback I see is parking, which I think there's potential to, if we reopen the Greenport site. Now, right now, the Hudson site is open Monday through Friday, 9:30 to 1:30. We, you know, wouldn't be able to bring on an additional staff member at this time. But if we were to locate a volunteer, either a volunteer to run the Greenport site, or if Hudson wanted to provide a volunteer to offset if we moved our staff, my thought preliminary would be keep Hudson open at the library Monday, Wednesday, Friday, and then take that staff member to cover Tuesday, Thursday at the Greenport site.
Is that is Tuesday and Thursday like the minimum amount of days or the maximum that you're allowed?
We could do all 5 days, but we only have one staff member to work with.
Okay,
So, down the road, if we increase the staffing capacity, if we increase volunteer, Canaan and Elizaville are both sites that are volunteer led, not staff led. So there's potential to open that up.
because Greenport Seniors is doing a meeting on Thursday and I can't go, so I just sent a text
And I'll
to.
see Lewis tomorrow.
Yep, and
to
let
tell
him know
Yeah.
that, all right, so, and I sent it to Guy, oops, and to let him know, and that they're seeking of, yep, and that they're seeking of volunteers as
Yeah.
well, so.
I think
So,
there's a
yeah.
lot of potential there.
Mhm.
Valatia, I should mention, right now, we're only open 2 days a week, but Valatia, by going back to their center, they want their programming staff to open a third day, so it would be Monday, Wednesday, Friday. there
They
with
never
their staff.
remembered, there was never any problems, they kept it neat, and clean, it was, it was.
It's a good group.
Yeah, because
The
it's got the
Hudson
kitchen
site,
and the hallway and.
the Hudson site is the one that did the pink t-shirts for our senior day, if you saw those pictures. It's a good group, and it's big, so and I know there's people at the that went to the Greenport site that don't come to the Hudson site, so I'd like to see that. I think
Yeah.
that was all good.
That was the closing of the site during
And
COVID.
then-
Right, yeah.
Well, thank you for tracking these measures down. I think this is very positive.
By saving the $400 at Hudson and $275 in Glacier, that brings more money back in the program, so maybe we could, look at additional staff in the future.
And as for your public hearing there, you actually had numbers from Glacier saying, please bring it back. So
Yes,
that's very positive. I had a motion and a second. Any further discussion?
I would like to just jump in quickly and maybe I'll give you a call. Maybe we can solve staying in the city of Hudson and parking. And
What I'm hearing. Yeah,
maybe we can talk about that.
okay.
Thank you.
Thank you.
All in favor?
Aye.
Opposed? All right, everyone, I think we're gonna have to entertain a motion to go into executive session based on personal financial credit or employment history of a particular person or corporation. Do I have a motion?
I'll make that motion.
Second.
Further discussion? All in favor? Okay, we're going in executive session. I am going to ask supervisors
Yeah.
I just want to personally say, when we talk about, if that is the need, our family had personally dealt with life alert with my mom for a number of years, and we think it was just $700 a year or something like that. But it was a wonderful service. I mean, they really did a good job. They did what they say they do. They communicated with us on a regular basis, so.
I would
if that
prefer to
was the
hear
need
from one member of the
for a
public.
particular person,
I'm sorry I encroached onto your time, Rob.
It's fine. Only you could do that.
And I can't watch your show either, because I gotta leave for 2
that may
weeks.
be a
I'm
time,
home.
if we had to pay that for somebody, because it's a program that already exists.
All right. Before we call this meeting to end, is there any public comments?
Thank you. I'll return them.
There being none, and then ask for a motion to adjourn. So moved.
Motion to adjourn in a second.
All in favor? Aye.
Okay, I'd like to call the November Public Safety Committee meeting to order, please. 911.
Good evening, everyone.
Good evening.
I have a resolution request which was presented before, but we're just doing a budget adjustment to utilize it, the 2024 funds, and it's for a grant, the FY 2024 Emergency Medical Performance Grant, totaling $26,675 with a match of 50%. Again, this is basically, we're going to use this opportunity to replace the EOC video system up at the Emergency Services Building. The current one's not capable of handling the platform that we're trying to execute. So we're working with MIS on that, and they're covering a 50% match.
Move it.
Second. All in favor?
Aye.
Opposed? So carried.
Next resolution actually pertains to the old Lebanon Tower site land lease. And in order to execute a termination with the land lease, we have to clean this site up. So I had our site contractor give us a quote to clean it up. I then sat down with the landowner to actually make sure we were talking the same language, so to speak. And we also discussed the option of the lease termination with a lump sum payment where the could walk away. And then the landowner through his company would actually clean the site up on his own. And the benefit of that is it's cheaper than the site contractor quote. And we also get to terminate the lease payments as of the November 24 payment. So it's less money. So I recommend a resolution authorization to do a lease termination and pay a lump sum of $15,000, which is the quoted amount, and walk away without having to do the work. So we don't have to manage the demolition or pay an additional 3 months of lease.
I'll move it.
Second.
All in favor?
Aye.
Opposed? So carried.
And I'd like to thank you finally for having this. This has been what, 10, 12 years I've been bugging you?
It's been a
for this?
while, yes.
It's been forever that I've been asking to get rid of this. Thank you.
You're welcome. The only other thing I have is the agency data for October. We dispatched 1,372 EMS agencies, 429 fire agencies, 1,798 police polls, and 407 public service calls.
Any more questions? It's dry.
It's very dry. Great Barrington's experiencing
Yeah,
a fire today.
that's right.
So, it's getting close.
Okay, thank you.
Thanks.
So George is not here for fire. Resolution should be presented as add additional per diem positions.
It's not increasing his budget. I mean, it's just-
They went through point one. It's just adding more instructors, the opportunity to have different instructors
Within the same budget.
within the same.
I'll move it.
Second. All in favor?
Aye.
Opposed? So carried. And emergency management. Welcome back.
Thank you. I just wanted to give you an update. Of course, our monthly report is there. Glad to answer any questions about that. And I wanted to give you a quick update on the general election day, safety and security effort that we've been doing. On our end, we feel that it went very well. We had very good participation in our partial activation of our emergency operations center. We wanted one place that was a central location to receive any calls or whatever, to be notified and we know what calls came in relating to any polling place. And there were very few calls. There was one call or two calls where people were questioning why law enforcement was visible. The patrols would sit out in the area or whatever. One person said they were intimidated by that. There was another call. There was one other call. Rob, was there another call on something else?
There was a call about poll situations.
Oh, yeah, I think it was signs, political signs too close. Yeah, so with 2 or 3 calls for that whole day. It really, it was a success on, as far as we're concerned, because that was very, very few calls. And that would have been, you know, we were made aware of any call that came into 911 or any law enforcement agency. I haven't, just today, I reached out to the, both commissioners and Board of Elections to see how they feel. I have to see if they want to have an after-action meeting. I don't want to bug them. I want to give them 2 weeks. I think they're still busy doing things. So,
Extremely.
you know, I wanted to put the offer out there to meet with them and go over how they feel, but they haven't indicated that there was any issue as well. All the part-time police agencies, Stockport, Belmont, all the agencies participated, had patrols out. And I think if something had happened, we would have been as ready as possible. But it went well,
Thank you. You did a great job. I mean, I think the proactivity of it, the planning was great. and,
especially from Montana. It looked good to me.
Yeah.
And everybody did a good job.
Give kudos to our Board of Elections. Everything really ran
Yeah,
smoothly.
everybody did a great job.
And they've been working. Making sure that people understand what to do on different things. So,
Terrific. Any questions? Any questions from the committee? It's a short meeting.
Just for the record, and I won't prolong this, but I said it the other night at the board meeting, but we had quite a few volunteer firemen go down to Ulster and Orange County, and I just want to thank them for the record for their work and going down and helping. You know, like somebody just said, Great Barrington now, it's awful dry out there.
You guys got called out, right? It was
yeah,
close to the
that-
border.
That it turned out to be, it was dispatched as a structure fire up in the Auslitz Hills. And
Yeah.
it turned out to be a brush fire over in Massachusetts, which they're still fighting.
Yeah.
There's a report on the bottom of, George's, the New York State Fire Mobilization and Mutual Aid was put into effect November 9th for multiple large brush fires throughout Ulster, Sullivan, and Orange counties. Through November 18th, 12 Columbia County Fire Departments were supplied equipment and over 150 firefighters to assist in the fire suppression efforts through 3 separate 12-hour shifts and 3 different 72-hour shifts. During the same time, the remaining volunteers have responded to multiple emergencies and working structure fires within Columbia County.
And I will just say, people really need to not burn. New Lebanon did a burn ban, then the county did the burn ban, and the state did the burn ban, and
We're
we're
leaders.
still having people
Yeah,
burn.
that's right.
We just had a DEC issue a citation the other day to somebody, oh, I know how to contain it in my burn barrel.
We had someone in our town blow 3 or 4 wands worth of leaves into the road and then set it on fire. I'm like, you could have set the whole neighborhood on fire.
Fire companies
got arrested, by the way.
Jumping right on it. Which
Yeah.
is good. Whenever
Yeah.
something, you know, comes up, they're right out there.
Well, our fire chief contacted me saying, can you do a burn ban? I said, I don't know. He said, Nassau did. So I called David Fleming. He said, here's the template. I think I called you to say, couldn't the county just do one? And he said, no, it's only Canaan and New Lebanon at that time.
Right.
But then 2 days later, you issued one. Because every time, like, why each town has to do one, when we can do it, you know, and then the state followed suit, so.
Any questions from the public? Motion to adjourn. Everybody have a wonderful holiday.
So moved.
Second.
Second, all in favor?
I.
Opposed? So carried.